It's all yours.
Good evening, everyone, and welcome to our February 2nd FSHP Town Hall. I think we're going to have a lively group tonight. We have a special guest. I'd like to introduce everyone to Dan Kudo. Dan, would you like to wave and smile at us? He is the president of the California Society of Health System Pharmacists. And we are looking forward to some collaboration this year, or I should say, starting this year. And I see some more people have joined us, so very good to have everyone. Welcome. Tamika, do you want to share the agenda? Thank you. So this will be our agenda for this evening. I won't read it to you, but if you want to just take a moment and look over it, and then I will get us up and running. I typically don't present as much as I am going to tonight, but we have a lot to talk about in terms of legal and regulatory update, and that's where a lot of my energy and time has been going to, but it's my passion, and as we will learn from Dan, it's his passion too. So let's start with office restructuring. I want to thank our president-elect, Bill Ternius, because he rocks. And he put a lot of work into looking at our current office structure. He compared us to multiple large state societies, and he found that we have a gap in our office restructure. I'm sorry, we have a gap in our office structure. So he proposed to the executive committee that we need to hire a full-time pharmacist, executive vice president, one who lives in Florida, for hopefully Tallahassee, and we also need to add an executive administrative assistant. So I would like for Tamika and Kevin to just show your beautiful faces to us so we can all see you, because these two carry our load and we are growing and we need more help. So I want to acknowledge you, Kevin. I want to acknowledge you, Tamika, and say thank you from the bottom of our hearts for all the hard work that you do. And help is on the way. Yes, Dorothy Fox has it. So it went to the executive committee. It passed unanimously. It went to the board of directors. It passed unanimously. So we are in the process of hiring the executive administrative assistant. There will be a job description put together, and we will be seeking EVPs with experience to come to Florida. It's not a bad place to live. So thank you, everyone. Next slide, Mika, if you would. So I want to talk about legislation, and I want to talk about it because it starts in March and it's this quarter, but I just want to take a little agreed, Jeff, thank you. Take a little walk down memory lane about what we've been able to accomplish over the past few years. And I want to acknowledge FPA President Carol Matichka, because together we can accomplish so much. And this is just an example of that. We currently have 2 pharmacists in the Florida legislation. That's a typo there, excuse me. And we have Shane Abbott and we have Gallup Franklin. So we have a pharmacist in the House on the Democratic side and the Republican side, and that really is perfection. We were able to pass our necessary Class 3 license. We were able to expand the consultant pharmacist license to ambulatory care. We were able to expand immunization authority, technician immunization, student immunization, and FPA led the charge on test and treat and chronic diseases. Kudos to you, Madam President Matichka. We are able to administer long-acting antipsychotic administration, so administer long-acting antipsychotics and naloxone prescribing. So we've come a long way in a few years, and I'm very grateful to Joseph and Gray Robinson, our team. Okay, Mika. So I came across this yesterday, President Biden to end the COVID-19 emergencies on May the 11th. So I thought, what is this going to do to the PrEP Act? So if you'll go to the next slide, Mika, we'll find out. So the bill that was passed in December by Congress, and that includes the PrEP Act and the HHS and all that authority, will not expire until probably December of 2024. So we still have time to continue to work under the PrEP Act, even if the pandemic is declared officially over. Thank you, Mika. So what does the 2023 Florida legislative session look like for pharmacy? The answer is PBM reform. If you'll hit down for me one more time, Mika, I forgot to tell you I put animations in here. And it's about PBM reform one more time. In case you missed it, it's PBM reform. And the fourth topic is PBM reform. So we have been told by our lobbyists that we need to sit tight on anything else. And the governor, I think if you'll go to the next slide, put out an executive order around the time of our annual meeting in August. And he went after the PBMs. So it is our expectation that what he brings forward to us will be more of what he brought forward in August. So the call continues to go out to our membership. Please capture patient cases who have been harmed or nearly harmed where you had to make an intervention, or white bagging practices. And also, semicolon here, we'll also be looking for 340B protections as well. This is our legal team. This is Joseph from Gray Robinson, Reeb at the bottom, and a lawyer in training. So he's called a law clerk, David Allen. And he is working on us to make, working for us to make a repository of talking points for every group of key stakeholders for every topic that comes our way. So there's lots of very exciting stuff going on. And we always defer, because they are the experts, our legislative strategies to them. They did tell us, bring patient cases. When we need them, we're going to call you, give us your cases. So if you have any availability to send to Mika some cases, that would be optimal, especially at this time. So Mika, if we'll go to the next slide. So it was announced on my way to CE at Sea. It was announced that Governor Ron DeSantis unveils comprehensive legislation to PBM reform. So it would include big pharma transparency and accountability and lower prescription drug prices. So we're simply waiting for this bill to be filed, but it's a very exciting time. Mika, thank you. So I did want to share with you that Drug Channel's updated this slide, and the way that you read this is from top to bottom. So you read the columns, and this is the most updated look at pharmacy benefit managers who you can see actually go across the slide. But the insurer owns CVS Caremark, who owns Zinc, who's a GPO, who owns their own specialty pharmacy, and they have their provider services. So if the Federal Trade Commission nationally, if we in Florida and the states continue to allow this to happen and we take no action, eventually those columns are going to include hospitals. So for example, Aetna may say, if you have Aetna insurance, you will go to hospital A. You will use doctors out of this health system A. And so we know that we need to kind of rope this in. And I don't know why my cat has decided to sing me a symphony, so excuse the background noise. Mika, if you'll go to the next slide. So I want to talk for a moment about Florida provider status and our strategies, and then go into national provider status. So go ahead, Mika. So there's two ways to do this, I guess actually three. And that is to either legislate that pharmacists are healthcare providers into the insurance language, which is statute number something. And Dave, I think I sent the number to you. So we would actually have to legislate that in the Florida Insurance Code, statute 600 and something, the number eludes me, we would have to put the word pharmacist in there. And that's not an easy task to do. So we know from history that the nurse practitioners in Florida we're the last group of all 50 states to be able to write a 3-day supply of controlled substances. Florida was the last state, and that was predominantly because of the physician opposition. So there is a much easier way, and that involves negotiation directly with Medicaid and also with commercial insurers. Now, there is the best of all possible ways, and that is to get the national provider status, and the states will all fall in line and adopt what is done at the Social Security National CMS Act. At that level, the states will comply with that. So that it really is the best strategy. So our plan this year is to negotiate after the legislative session. No one is available to negotiate with right now. They're all up in Tallahassee trying to get bills passed or block bills and such. And then we're going to spend a few times. We have a guest visitor with us. His name is Dan Kudo. He is from the California Society of Health System Pharmacists. He is the president, and I just spent some time with him, and it's remarkable to me how pharmacists were trained in the same way. We all think the same way. So we're going to kind of talk about aligning with them a little bit. Okay, Mika, if you want to go next. So I think everyone is aware that we had a grassroots outreach based upon what ASHP told us. They told us that the PrEP Act intent, so this deals with both immunizations and Paxlovid prescribing, that CMS told the Medicaid program and the Children Health and Infant Program that they are to cover pharmacist cognitive services related to COVID-19. So they encouraged us to sign a letter at the national level back to CMS to say, hey, this never happened in our state. And to also reach out to Tom Wallace, who is the administrator of Medicaid in the state of Florida. So you can see there a letter that we put together. ASHP coached me to ask them, what are the CPT codes and what are the E&M codes? And there's some other information in there that they asked me to ask him. So when we first reached out, the response was, well, yes, you can do that. Pharmacists are providers. Well, what is the pathway for credentialing? What is the pathway for billing? And we did not hear back from him. You can see that email is dated December 19th. So we've been told by our lobbyist group that they are now actively engaged in legislation, they being Medicaid and the CHIP programs. And so we should defer this until after the legislation. The legislative session starts the first Tuesday in March this year and goes through the end of April. So it's a 2-month session. And because it's an odd year, it starts in March, and even years, it starts in January. Thank you, Mika. I do want to show you, these slides were provided to me from ASHP. These are the states who can bill for services. Kentucky recently was added through negotiation. So we've reached out to ASHP and asked them to provide us a list of states who went through negotiation, because we want to be able to say to our the commercial and Medicaid, well, Texas does it, Kentucky does it, these states all do it, and therefore we should do it. So you can see on this slide, the light blue is Medicaid only, the purple is both, and Ohio has some stripes there, and honestly, I can't recall why that is, but I can follow up if anyone's interested in that. Mika, if you'll go to the next slide. So what's happening is that states are getting carve-outs. So when you can't get what you need, you take what you can get. And we've learned that that's called government being incremental. So some states are opting to prescribe hormonal contraception. This is a list of those states, but I don't believe they're necessarily being paid for it. And that's the key here. Can you go to the next slide, Mika? And here we see PEP and PrEP. By the way, there is a bill for PEP and PrEP this year. We're not anticipating that it will move, and we won't put a lot of resources behind it this year, but that doesn't mean that we won't in the future. And that is because the strategy provided to us by Gray Robinson is PBM reform, and PBM reform. Thank you, Mika. So I'm going to switch gears here and just mention something. I don't know if Bill Kernan is on the call or not. He's done a bang up job working with individuals within our membership to present at the Board of Pharmacy meeting next week. So we want everyone to know that the USP 797 pharmaceutical compounding sterile preparation board subcommittee meeting is happening next Tuesday at 9 a.m. in Orlando, basically. So it's the sterile compounding subcommittee agenda. And we will have a big presence there and we will report back to the members. But if this interests you and this is something you or your health system want to send people to, then we would encourage you to do that. Thanks, Mika. Another topic of interest is the disease states. And I don't know that this is my most updated slide. However, this is the FPA bill that passed in 2020, chronic care management, and the Board of Pharmacy must work in conjunction with the Board of Medicine and Board of Osteopathic Medicine to add more disease states to chronic care management. So Mika, if you'll click one down for me. So John Armistead and Lee Health has asked for this rule to be open at the board so that hepatitis B can be added to the disease states which are under these collaborative practice agreements in chronic care management. So we are asking the membership to help us identify what other conditions we should ask for to be added once this rule is open. And Mika, I think I put a couple in there. So it came to my attention today, alcohol abuse disorder. We do have tobacco abuse disorder and we have opioid use disorder. So to change that verbiage to, thank you, Elias, can you put that in email to me? Alcohol abuse disorder, we're going to ask for it to be changed to substance abuse disorder. And then it was also mentioned to me mental health. And diabetes, I think, is in there, but I think that it's off my slide. Thank you, Elena. If anyone knows definitively, but I do think it's there and wants to comment in the chat, that would be awesome. So if you have some ambulatory care topics that you would like to see added, we cannot prescribe buprenorphine. We cannot prescribe any controlled substances. So I'm just putting that disclaimer out there. It's already in the statute and we'd have to get a legislative change to do that. So Mika, if you'll do the next slide for me. So as I said, Bill is working with that committee and they've done a great job, and I was reviewing what they're working on right now. So thank you, Bill, if you're here, and all the other members who are on this subcommittee. We're great because you're great. So let's go ahead, and I want to introduce Dan. Mika, can you change our view so we can see Dan? Dan, you're on mute.
Hi, everybody.
Do you want to tell us about yourself in a minute or two?
Sure. I am currently president of CSHP, and I think that Kathy and I've learned a lot from Kathy already, and I think that there is a great opportunity to collaborate. I've pretty much done everything in my career. I've been a health system pharmacist, a managed care pharmacist, and my current practice is geriatrics. So I think that there's an opportunity for our societies to really get together and find some ways that we can amplify the message of the pharmacists.
Thank you, Dan. And we'll go back to the presentation and then we'll matter here. So what Dan and I were discussing was national provider status and the importance of talking about it when we're talking with physicians and legislators, which we're not doing at this moment, but this is strategy I'm sharing, is to refer to it as physician-led team-based care. I've never had a physician say to me, I do not support physician-led team-based care. So I think when we talk among ourselves, provider status is fine, but when we talk collaboratively or interdisciplinary or with legislation, we probably need to call it physician-led team-based care. And I made my own abbreviation for it there. Petra, don't show that to the Joint Commission. Okay, if you want to go to the next slide. So I don't know if you've had the opportunity to see this or not, but I've done this for all the professions except for the social workers, and that's because they don't publish anything. But this is our timeline as our profession. And this is national. So I've stepped away now from Florida and I'm going into national. And you can see here that we first tried to obtain provider status in 2015. It's not uncommon to take 10 to 15 years to get into the Social Security Act as a healthcare provider. And the way that every group has ever gotten into it is through what we call a carve out. And a carve out, an example of that would be pharmacists can be reimbursed for cognitive services and physician team-led based care, physician-led team, that's right, in the medically underserved. And that was the carve out that the nurse practitioners and the physician's assistants got. We may have a better carve out coming our way, and it may have to do with equitable community access to pharmacist services because of the pandemic. So this is a strategy that everyone is watching nationally. And our hope kind of is on this. So Mika, if you want to go to the next slide. So this is how I met Dan. Well, I met Dan at ASHP summer meeting, but I was talking, Mike Shue and I, and I'll talk about Mike in a second. We had a meeting with the Rita Shane. So I don't know if people know Rita Shane or not. If you don't know her, you're missing out because she is spectacular. So I contacted her after I had a binge of The Resident, watching the TV show The Resident. And I had also previously binged on Chicago Med. And I was kind of upset because in The Resident, they portrayed a pharmacist. Now, remember, these two are emergency department shows. These emergency departments do not have any pharmacists working in them. So The Resident portrayed a pharmacist who was stealing from Medicaid. So she was a community pharmacist. She was overbilling Medicaid, filling fraudulent scripts because she needed money, and she had worked with the mob, and she ended up dying in the episode. So that was their presentation of a pharmacist. Simultaneously, Chicago Med was bashing pharmacists, and this is what they said. They said, well, we'd really like to give you this medication, but we can't because the pharmacist will not give it to us. It is on a back order and they are not letting us have any of it, even though your very life depends upon it, is what they said to the patient. And then two physician characters stepped aside and one said to the other, I know some pharmacists who are bootlegging that drug. It'll cost us a lot of money because they're greedy, but we can get that drug and save this patient's life if we're willing to pay for it. And I was reminded of that article that was published actually in APHA journal. So JAHP, whatever it is, by the grassroots pharmacist, E. Michael Murphy. And he said there are 3 barriers to why pharmacists are not included in the Social Security Act. And the first barrier is because of public perception. The second barrier is the CBO score, which he recently published, is probably already resolved itself through a carve out. And the third problem is that we don't advocate for ourselves. So what we're focusing on, and Dan, at the same time that we're meeting, Dan is doing the same thing. And Rita said, you know, Kathy, you need to get with Dan, and he's already has this in motion. Now, Rita also pointed out after we had this discussion that nursing has a very favorable position in the public, and they are an essential professional. But pharmacists are ancillary services. And ancillary derivation comes from female servant or maid. And so she said to me, why don't we create a national awareness campaign and talk to Dan? So Mika, if you want to go to the next slide. So I contacted Dan, and Dan, do you want to tell us what you're doing in this vein?
You want me to talk about the video, the idea of the video?
Yeah, and your mentor, and he lives in Orlando, and
Yeah.
everything like that.
Okay, so everyone, just so you know, I'm a pharmacist, but my avocation is videography. And I got the opportunity to meet Bill Suchy, whose name is spelled S-U-C-H-Y. So if any of you want to look him up, Bill is a videographer, and he's my mentor. He's been my mentor for more than 20 years. Bill is the recipient of 1 Oscar nomination, 7 Emmy nominations, and has won 4 and is up for his 5th right now for documentary work. Bill and I are working on a project right now for making the public more aware of, not just aware of the roles of pharmacists, but the roles and the value. And my plan is to tell it in the voice of the patient and in the voice of the physicians that support and that we support, and the medical teams that we support as an integral member of the team. Bottom line is that the effective storytelling will be a story told in a voice other than just the pharmacist. And so that's, Kathy, that's kind of what we're hoping to, just get some ideas from you, and we would love to work with you in any way we can.
You're on mute, Kathy.
Thank you. We'll be talking about this at our upcoming board meeting, and I'm very grateful to you for what you're doing and how you're leading. And we also talked about an outpouring of support to I just actually emailed whoever does the resident, I forget her name, and I said, we'd really like for you to write in a pharmacist on your TV shows. And I'm thinking maybe we'll just do a grassroots outreach to them and let them know that, hey, you're missing out. But they could really benefit us if they would help us in that manner.
And
So
I may, Kathy, I may be able to engage Bill on helping give us direction in that area.
perfect. Thank you, Dan. So yes, keep us updated and we'll be in contact. We also thought we could reach out to Pharma. Johnson & Johnson, and we'll make these videos available for you afterwards, has a 2-minute video like worshiping nurses. So I think it's time that we reach out and say, what can you do to help the profession of pharmacy? And our thought is to engage the colleges of pharmacy. This is a video given to me by our nurse on the naloxone team. She used to work for the Department of Health. She now works at UF. She said colleges that have public health schools are very likely to put together videos. This was how the naloxone saved a mother's life because she became, she suffered from substance abuse disorder. And it's her story. And USF, College of Public Health, put this together. So I'm going to start to engage you, Carol, through both the FPA and UF and the other colleges as pharmacy as well. And then Mika, if you'll go to the next slide. Okay, and then this is our subcommittee for provider status, which just started. Mike Shu is our lead. Of course, physician-led team-based care. Once the national bill is filed, Mike is going to work on putting together a grassroots outreach to our congressmen and senators. And this is our current team. Of course, we're always interested in engaging more people. But Mike, did you want to say anything here?
I can just say a couple of things that we're going to take pretty much a multi-pronged approach where we're going to have a track of where we're going to seek collaboration with physicians, of course, but we're also going to, we want to find ways to pay for airtime to get in front of people to show what pharmacists do. I mentioned the other day that the dentist did this back in the 60s, where you had your annual dental appointment this year. So to create public awareness of really what we do, because we've always been secretive about what we do, it seems. And then on the other hand, we also want to make the awareness, but to pay for these things, but also negotiate with payers, at least at a state level, where we can get paid adequately for these services to share them with everybody. I got to say that I work at the top of my license every single day, and I'm grateful for that, but I would just love to share it with everybody in an AmCare setting where I'm working with physicians, probably at least 50 different ones that send patients to us every single day. And just for pharmacists, we're like a specialist in-house that we talk in depth to patients about their medications. We write extensive notes. They're put in the chart. We make recommendations to the physicians. And our latest data is showing us that probably 50-something, 60-something% of this, the providers actually listen to us and follow through on our recommendations. So I would love to share this with everybody, but the only way to do it is to make the public aware, to push demand by the public to their providers and their payers to get this done. And you can do that. And there's ways that the insurance payers can win too. That is, you can do things like have a rider on an insurance plan where somebody for a certain amount of premium a month more, they would have pharmacist services added to their insurance plan. So these are the kind of things that I think we can do, that we can push, that are a good negotiating tool where everybody is a winner with it. And so we're gonna explore these things, and we're in the process now of making up strategies to utilize a dual track of pushing demand, but also creating a more positive view of us as pharmacists.
Thank you, Mike. So Mika, if you'll go to the next slide. Okay, so we had a special request, and thank you, Mike. And Dan, thank you for being with us tonight. And I know that you're going to be leaving us to go to your meeting, but we'll be in touch. Farima is asking if she can go next, Vanessa, if that's okay with you. Go ahead, Farima.
Thank you so much, everyone. And I apologize as I have a conflict in the schedule. I have a meeting right after this one. So my name is Farima, and I'm the Regional Society delegate between the FSHP and all of our regional societies. We would like to provide an update, but first let's talk about some fun events that we had earlier this year. So the second week of January, our Southeast Society had their annual CE at the CE event. This picture is from that event. We had a great time. We were able to receive some education, CEs, and reconnect with some of our colleagues. Moving forward, if you have a picture from a fun event that you would like for us to feature and share with everyone, please feel free to send it to us. We would love to see all the fun events that you are doing at your regionals. We also have a news regarding a new regional society. So we have our Northwest Florida Society of Health System Pharmacists joining us as the newest member. That includes the Pensacola area, Crestview, and other cities surrounding that area. So if you are living in those areas and you always had a dream to have your own regional society, that dream has come true. And the last slide that I have is regarding Committee on Resolution. So this is an official call for volunteer for Committee on Resolution for this year House of Delegates. As some of you might be familiar with this committee, it's appointed by the chair of the House. And this is a great opportunity for you to get involved if you are interested in policy and procedure, process improvement. As part of this committee, you will be reviewing all the submissions that we are receiving from our members. As a resolution, we get to discuss, the legal issues associated with some of these recommendations, the intent of the recommendations, and also discuss the feedback that we are going to send back to submitter. It's really fun. It's only 2 or 3 virtual meetings during the May-June time frame. And after that, you do not have a continuous commitment to the committee. So if you are interested, please go ahead and email me. We can add you to the list, and we'll let you know when we are starting to meet.
Thank you,
That's all I
Farima.
had, Kathy. Of course.
Appreciate you. Thank you.
Thank you.
And back to our regular scheduled programming. Is Vanessa on the line? If not, I can go ahead and present on her behalf. I'm scrolling down. Okay. So Vanessa is our historian, and she's putting out a call, if you'll go to the next slide, to directors or chief pharmacy officers to take the ASHP PAI survey. Petra, I know that you took the survey for our health system. Do you want to say something about it? What did you think about it?
I thought it was very helpful. I was interested to see the questions that they asked us specifically about integration of technology. I think for me, it prompted some things that I hadn't necessarily considered, like asking how pharmacy might be involved in wearable medical devices and our management of those. So I think for me, it helped me understand where I stood, see some potential, as well as it gave a great summary at the end that I think is a good talking point to some of our leaders within the health system as we work towards growing our services. So I thought it was very helpful. And I personally believe that anyone could do this for their own facility, like with your perspective of how pharmacy is involved. So, but I did it for you, Kathy.
Thank you, Petra. I think we're the only health system. There may be another one or two. So thank you. If you'll go to the next slide, Mika. And this is where you go. So it's actually PAI 2030 tool.ashp.org. You create account. And Petra, do you agree it took about 45 minutes, or did you feel it took longer?
No, I think that's a fair estimate.
Okay, thank you very much. So what we're going to do, if you go to the next slide, if you'll go backwards, sorry. We're going to ask everyone to take this, and then in April, we're going to start recruiting for the PAI team, and we'll have some of those results back from ASHP, and then we will be able to strategize. They actually have given us a roadmap to follow. So if you're interested in getting involved and haven't been able to do so thus far, this opportunity is coming your way. So thank you, Petra, and thank you, Vanessa, in your absence. Okay, Mika, if you want to move forward. So it's Black History Month, and we are going to celebrate our members. So there will be a series of social media communications. We are celebrating our diversity, and in particular, our Black pharmacists and our technicians, so that we will be profiling their contributions to both FSHP and pharmacy. And we are working on the distribution of the DEI survey, Diversity, Equity, and Inclusion survey. So I'd like to profile one such pharmacist here, Mika. And this is Angela Hill. She is a professor at USF, and she is awarded, I'm going to read to you what this is. This was at ASHP. She won the ASHP American Black Health System Pharmacist Joint Leadership Award for exceptional leadership in efforts to reduce racial and ethnic disparities in healthcare. And interestingly, she's profiled here with John Clark, who won the award several years ago. So I am here today to acknowledge and thank Angela Hill for her excellence and her dedication to our profession and to FSHP and ASHP. So if you want to go to the next slide. I want to mention here, and I have to put a disclaimer out, I'm not making any money. I want to acknowledge John and his work in diversity. And he wrote this book on early education of African-American pharmacists. And I read it and I love it. And I have given it as gifts to my friends. So I want to also acknowledge and give John accolades. He is very dedicated to FSHP and a past president. So thank you, John Clark. He is leading our outreach. Okay, next slide, please. So we are diverse, and our goal is to have leadership look like its members, award recipients be diverse, and to embrace Florida pharmacy, that our health systems, that our pharmacists and our nursing staff and all of our staff look like our patients. So that is what our goal and our intent is. Next slide, please. So we had a live meeting in January, and I'm only going to be able to profile 2 groups here, but I do want to acknowledge the hard work of all of our component groups. This particular group is the DEI component group, and Aaron Johnson, who happens to work for Johnson & Johnson, Gwen Collins, Ernest Alexander, and John Clark are members of that committee leading this charge. So I would like to acknowledge them and thank them for their dedication to FSHP. Next slide, please. I also want to acknowledge our technician component group. And we've got Deanna's, Jeff, Cheryl, Elizabeth, Sharita, Anissa is our chair, Tara, Veronica, and Patrick. So thank you all for your dedication to FSHP. Next slide, please. We'll skip this. So we're coming to the end here, but I want to get Dave in first. Dave, do you want to go ahead and present?
Yeah, I'll be quick, Kathy. I could throw the financials up here, but I'm going to bore the group with that large number on there. So just to highlight, there they are. You can throw them up there if you want. It's there. Sorry. Do you want me to, Tamika? Or so, guys, just really quick, I threw this on here just so you guys can see as the close of December 2022 in the first column, our total bank accounts, how much money do we have, is at 1.391 million versus last year of 1.390. So you can see that we got cash being maintained in our accounts in a healthy way, and cash is there and also behind us in our ability to restructure staffing, as Kathy alluded to, moving forward. As you look at this first document, the one thing I like to highlight is that 651 number. That's actual our checking account. Our checking account is cash. All the investments above are more investments. They're in investments now, like bonds and stocks, but that's also cash. As you scroll through the slide to the second page, you will actually see, and I don't want to spend too much, I'll explain this variance in the next section, but scroll down. Total equity of our finances at FSHP, that total equity line, the second one from the bottom is at 1.312 versus 1.354. Again, pretty consistent from last year. As you can see, our cash is staying in the account and being managed well. So that's the only finance document I wanted to show you. I wanted to touch on 2 points for the town hall outside of that. Kathy, you can go back to your presentation, but we did receive our external audit letter. We are going to receive that external audit letter, which basically says, and I talked to the external accountant, everything's in order, but we do have to start moving to an accrual-based accounting system versus cash-based. Basically, that just means we have to update our processes. Nothing wrong with the integrity of what we're doing. We just have to update processes. So we are this year rolling out updates to all of our processes. We think by the close of this fiscal year, we will have all of those optimized, in place, and running. So that's pretty good improvement as we process improve within the organization of financials. And I think it's going to allow us for better projections of finances and better goal setting within the organization as we move forward. I'm going to pause there and just ask if there's any questions from a financial standpoint for the state organization. All right, with silence, Kathy, I'm going to hand back over to you, and we'll go from there.
Thank you, Dave. I think we're back to, yes, thank you very much. So I want to just make everyone aware of some upcoming save the dates. I won't talk about the collaboration because Jeremy will do that, but save the date for March 31st. In April, we'll be having a webinar on new roles for pharmacists, wellness pharmacists. And at the open forum at the end of this, I know Scott Jelson wants to make a couple comments. Please remember the dates of May 11th to the 12th for the residency conference. And May 24th will be our next town hall meeting. And I guess I should also say the reason that I wanted to present this provider status, and I have to tell you, Tim Lahamade, I'm so happy that you're here, is because I'm going to dedicate the next 6 months, so half a year that's left of my presidency, towards changing the public's perception of pharmacists and removing that barrier. So that is my goal, and I need as much help because it's not about me, it's about our future. So thank you with that. Mika, if you want to go to the next slide. And there it is, the Pharmacy Residency Conference, and the annual meeting will be opened for registration, I think. One more. There it is. Opens in March 2023. Okay, Jeremy, you are up.
All right, thank you, Kathy. So for anyone who hasn't been made aware, we do have a new component group within FSHP. It's the Emergency Medicine and Critical Care Clinical Forum. So several specialty groups within pharmacy have national organizations for their specialty. The Infectious Disease Pharmacy Association, HOPA come to mind, but there is no such group for critical care. There is no such group for emergency medicine. And so when we were finishing up last year, Kathy and I were talking, what could we grow? How can we build something and have people come? And so I thought emergency medicine and critical care was a great pairing for folks in the state of Florida to come together and put together a group. Just some really quick numbers, 11% of all ASHP accredited PGY2s in emergency medicine are in Florida, 11% for the entire country in Florida. And it's 8% for critical care. So that's just, to me, it shows that this is a really strong group of professionals within the state. And so we put together a group for everyone to come together and learn and teach and grow together. So the first several months of our existence has been put towards scheduling and putting together educational events. Our first webinar, which is really going to be our first public showing of what we can do, is going to be February 16th. It's going to be a non-CE event, no CE associated with this one. We have 2 speakers for this event. The first topic is going to be new literature in AFib and RVR. So it's kind of more of an ER topic. And the second topic is going to be phenobarbital for alcohol withdrawal. And that's going to be both an ER and ICU focused topic. Our second event, the one that I'm really excited about, that we're collaborating with the Medication Safety Clinical Forum on, it really just started off as a small idea of talking about antidote safety. I'm a toxicologist, so it's a passion of mine to talk about how we can make our antidotes logistically safe, dosing safe for our patients. So working with the Medication Safety Clinical Forum, Nisha said, hey, let's partner with FHA and expand this out. And so once we partnered with FHA is like, this is a great idea. Let's partner with the Florida College of Emergency Physicians. So this like small idea really has blossomed out. And so this event is going to be held on March 31st from 2 to 3 p.m. This is going to be a CE event for pharmacists, a CE event for nurses, and a CE event for physicians. I think it might be the first time that we're having a joint event like this in the history of FSHP. So I'm really excited to have this event. We have 3 really great speakers. The first is going to be Ali Funk, who is the director of the Florida Poison Information Center in Tampa. The second is going to be Molly Stott. She is the Senior Clinical Toxicology Fellow at the Florida Poison Information Center in Jacksonville. And then our last is going to be Angel Maldonado, who is the Vice Chair of the EM and Critical Care Clinical Forum. It's going to be free to all attendees. You don't need to be an FSHP member. You can advertise this to all of your nursing colleagues, all of your physician colleagues, all of your pharmacist colleagues. So please get the word out. I think this is going to be a really good event to really just put the name of FSHP out within the state. We do have some other events planned throughout the year. We're going to have a focused event on disaster preparedness. Another idea that we've come up with is having a post-FERC CE. So we really wanted to put together some of the better, more diverse research that's going on at FERC, because FERC is a great place to share information, but I feel like FERC isn't necessarily like widely advertised afterwards. And so we're going to select some of the more unique research that's going on in the emergency medicine critical care world, put that together as a CE, and then broadcast that for all FSHP members. And then lastly, towards June and July, we're going to have a trauma-focused webinar just so we touch on some of those topics as well. From a diversity standpoint, we're definitely looking to have members from all across the state. And right now we're missing members. We don't have any members from the Capital Society, Northwest, Palm Beach, or Treasure Coast. So if you know any folks who are emergency medicine, trauma, critical care, toxicology in those areas, please send them my way. We want to engage with those folks. We want to give them a voice in our clinical forum. And with that, I'll end my time and thank you all for your time.
And I
Great
want to
job.
just throw out there that right now there are 102 people registered for the February 16th event, and
That's awesome.
the distribution for the medication safety event, I think it's scheduled for tomorrow or early Monday.
Great news. Great job, Jeremy and Angel, and all the members of that team. Thank you so much. You know, when we collaborate with FHA and we talk to, you have webinars and we're the speakers, we're talking to physicians, we're talking to nurses, and that alone promotes our profession. So thank you for that. This is spectacular on so many levels. Thank you very much. So I think that's our last slide. And so I'd like to open it, Mika, to questions. And Jeremy is putting a call out. If anyone is interested in joining him, you can either email him directly or you can email Mika and she'll forward it to Jeremy as well. So let's go ahead and open it up. Scott, I know you said you wanted to talk about something.
Well, it's putting me on the spot, Kathy. I'm shy on calls like this. And,
Don't kill me.
like public speaking. No, thank you guys, and honestly, I appreciate all of the information and updates. And Jeremy, that was a great presentation about all the events as well. As Kathy mentioned briefly, we are having an event in April about wellness, and we at our health institution actually instilled or hired the first 2 clinical wellness pharmacists in the nation. And we've been working with the likes of some of others on the line, like Stacy Maravent, as well as internally with Robert Bob, as many of you know him as. And we've been working to not only create electives for residents, but at the same time, create opportunities for students to engage in the wellness opportunities. Wellness is here. It's not going anywhere. It's a $4+ trillion industry. And we believe pharmacists are the most well-positioned to provide wellness services. There's a lot of opportunity. There's a lot of money being left on the table. And there's a lot of evidence around wellness that I don't feel we utilize greatly in our own profession. It's also a branding opportunity for us as a whole. When people think that we approach health versus healthcare first, it's an opportunity to draw new audiences in, new clients versus patients. One of the things that we always say is, physicians are experts at diagnosing and providing opportunities to prevent one with the right steps taken. We as experts in medications can also help you prevent one, synergize with one, and as well as deprescribe, which many of you have talked about, heard about. I know some others are on the line, like Michael, who deal with pharmacogenomics and personalized medicine. These are all pieces that make the pie. The big thing for me is really, we have to lead this conversation. And it can't be another conversation that corporations lead. And I will tell you that Costco, Walgreens, CVS, Walmart, and Kroger are leading these conversations as we speak. More so the Kroger and the president VP over there, Colleen, is leading this conversation in the nation. And I think it's one of those that if we don't get right, we're going to get left. And so I really hope that you guys will join us in this effort and understand there is a actual business model with ROI, as well as the opportunity to really engage professionals such as physicians, dietitians, and more to really engage our patient outcomes. So thank you for the time, and I look forward to seeing everybody and more information coming out and for that April event.
Thank you, Scott. Any other open forum? Questions, comments? Do you feel tanked up about provider status? It just seems, and Dan and I were saying that because of the pandemic, because of the lemonade we were able to make out of that terrible lemon, this is the perfect time to go all the way and obtain something nationally, a start, a carve out.
I know that Scott is the wellness expert here today, but I got to say that we explore that area too. If we get like a middle-aged executive that they're pretty healthy and they're not on many medications, they can check a box actually when they come through our executive medicine program and to see a pharmacist, and they might be on 3 medications. So what we do is we spend an hour talking about health and wellness with these folks. I go through their diet and we explore their diet and how ways to improve it, things they can do to exercise a little more, those kind of things. And you know what? They love it. People are willing to pay for these services, and pharmacists can own this if they choose to step up. So it's an out-of-pocket paying type thing, and people are willing to do it. And we don't always have to talk about medications all the time because we know plenty of stuff that other people know. We just don't market ourselves to it nor apply our skills to it.
Well, to add to that, Mike, you open the doors to, again, a new clientele that may not look at a health system as the place to be. But this is the thing that we all have to understand. If it's not us, they'll get it somewhere else. So why not?
Good points.
And can I just say a quick word, Kathy?
Please do, Carol.
I'm really excited and impressed hearing everything. This is absolutely what we need to be doing. We need to be getting the word out there. We need to be really promoting ourselves, as you say. It's just especially now. So whatever FPA can do to join in the fight, we are there. And I absolutely agree. The pandemic was terrible, but in many ways, it brought pharmacists to the forefront. And, just like I've been saying all along, lace up, don't stop. We've got to do this right now. We've got to continue on. So really, really exciting. Glad to have joined tonight. This was great.
Excellent.
Thank you, Carol.
And Kathy, I know we threw this slide up there, but to emphasize for everyone, we are at the Gaylord Palms Hotel in Orlando for the FSHP annual meeting. So the rates negotiated by Tamika are phenomenal. And the hotel is beautiful. So if you have not registered, or I don't know if we can register yet, but as soon as registration opens in March, I would strongly suggest grabbing a room or two to get out there for the annual meeting, because I know the content is going to be pretty rich as well. So Kathy, I just wanted to put the plug out there for that annual meeting, how important that's going to be. And the fact that you guys picked one of the best resorts in Orlando, Florida, for our pharmacists to attend. Kudos to the executive team and the office group who made that decision. So great job. And as Kathy alluded to, I think this year in Tallahassee, the #1 thing, and I'll say it the 5th time, is PBM reform. If we can get PBM reform, Kathy, that'd be huge for all of our health systems. Huge.
Incredible. It's going to be a great year this year. Mika, can you tell us the room rates? I know they're really low compared to if you go online right now and try to get a room for those dates.
Yes, it's $164-ish plus fees, but under $200. So we're looking forward to that.
So that is a save the date.
Yes,
Make a
definitely.
vacation out of it.
Yeah, they have alligators in the middle of the hotel, I think, and turtles and stuff, right? So pretty
They
cool.
do.
Spread the word. Thank you, Mika. Thank you, Dave. Thank you, Scott and Mike and Carol and everyone for spending your time with us. Thank you for your comments. And we will do this again in May. And with that, we'll end it. And I just from the bottom of my heart, thank you.
Right at 7. Great
Thanks,
timing,
Kathy.
Kathy. Good evening, everybody.
Take care,
Bye-bye.
guys.
Good
Thanks,
night.
everybody.
Thank you. Have a good night.